Welcome to Expert Voices in Dementia, where thought leaders from the field present insights from dementia research, clinical practice, and caregiving that will help you maximize the quality of life and well-being of your patients. In this episode, dementia care expert, gerontologist, and author Laura Wayman provides insights into what caregivers for people living with dementia need from healthcare providers and how clinicians can best partner with caregivers.
So, Laura, thank you. Tell us a little bit about your experience educating caregivers of those living with dementia.
Well, it's kind of surprising the way I got into this because I had no idea, even though I have a degree in gerontology, I had no idea what dementia care involved, just like most of us. I had learned a little bit about dementia in school, but then my dad began to show signs and symptoms of dementia. It was concerning to my mom. She knew that it was challenging because she'd seen many of her friends care for those with dementia symptoms. But she, of course, embraced it, being that caregiver at heart. They changed their lifestyle so she could give him competent care, sold their RV, and she stepped into that role. None of us in the family understanding how challenging this could be because she never really opened up about how extremely challenging this was. So over the years, it continued to take a toll on her physically until one night when she was caring for my dad, never asking for help, trying to do it on her own. One night she was alone with my dad and she suffered a massive heart attack. And we did not realize at that time how extreme this was on that primary caregiver, especially a same age spouse. And actually, statistics are kind of shocking. 68% of the time, especially if that caregiver is that primary same age spouse care provider for someone who has these progressively caused dementia symptoms, as they continue to decline, it's so emotionally and physically hard on that caregiver. 68% of the time, that caregiver will go first. And it's just so surprising because we, as the adult children, we weren't experiencing this. And I often say this when I'm training family caregivers or professional caregivers: you don't understand how this feels. You don't know what you don't know until you're actually in it. And often that family caregiver is plopped in the middle of this. It can be for an extensive period of time because progression of dementia symptoms can go on anywhere from 2 to 20 years, where that person will need more and more care. And the painful part about this, Joe, is that the better care they give them, they still can't stop the progression and that person getting worse. So it's so much of that non-immediate gratification. It's just so hard on that caregiver.
Tell us a little bit about your company and your book that you've written to educate others. They've been very successful and very well received.
Well, I appreciate that, but I did write this from my heart. I feel like my mom is on my shoulder saying, you've got to help these caregivers understand what it is they're dealing with. And so, I did get my degree in gerontology, but I've also worked in many, many different care provider hats. Of course, I helped care for my dad when my mom passed away. So I was a family caregiver. I've been an executive director for an assisted living and memory care community. So I've worked with the families in that kind of venue. And I owned a very successful in-home care company for several years. So that's Joe, that's where I learned about this different method of communicating and engaging because I kept going, this regular method that we're trying to communicate with someone who has this brain function loss, who has dementia symptoms, no matter where they are on their journey, this is not working anymore. So, what exactly do we need to change so that we can help them connect and engage with the world? And they're just in this totally different perspective.
Thank you very much. What are some of the goals of successful caregiving, particularly for people living with dementia? And how are those goals different than for other forms of caregiving?
When you're caring for somebody with dementia symptoms, you have to know that you cannot stop, fix, or change the progression or the symptoms or behaviors. You can only learn to better manage them, which is frustrating. We want to fix it, right? That's exactly why I believe the medical community is frustrated because they have nothing to stop it, fix it, or change it. And so helping that caregiver to manage it and still give that individual whom they're caring for, to give that individual some quality of life, some meaningful moments. And yet they still are struggling because as that most of these causes of dementia symptoms, such as Alzheimer's, the leading cause, it's progressive. They continue to lose more and more. So basically, the way I explain this to the caregiver so they can understand the best is that person progressively has more and more of a broken thinker. So it's not really about memory loss, it's about their ability to process all of this information their brain is trying to make sense of all day long, including making sense of what they see and what they hear and how to move safely and how to think and make decisions and pay attention. All of those real abstract things that person is losing. So that caregiver has to constantly step up and think for them and doesn't give them enough time to think for themselves. Whereas if they have, for example, if they have a diagnosis of terminal cancer, that medical community, their medical support can say, well, probably in 3 months, we're going to see this, and probably in 6 months, we're going to see this. With dementia care, everybody's so different. It could be, well, maybe in 2 years we'll see this, and maybe in 6 months we'll see this. And it's so different. And we have to customize our care so differently without any kind of professional support from the medical community because there is no cookie cutter way to explain this to these caregivers. So they're lost on this journey.
That's a very important point about not just being about memory loss, but about problems with processing and thinking and other activities. So, thank you for raising awareness of that. You speak with many caregivers. What do caregivers for people living with dementia need from their healthcare providers?
Often what I hear is that the healthcare providers who they bring their loved one to, um, they tend to, and they don't mean to do this, but I think they tend to talk over their head and talk about that clinical portion that that person needs to certainly understand. But they come away with such a misunderstanding about what that word means, dementia, what it means, and and that there has to be a root cause, and there's over 100 different root causes. There's illnesses and diseases and brain events, trauma. There's even medicine. There's even infections that can cause that brain to not be able to access this vital information. And then these causes are so difficult for for the medical community to really diagnose. They can't do an invasive brain test to find out for sure, is this Alzheimer's, is it Lewy body, is it a stroke? They can do scans and give some information, but then it still ends up as a best guess diagnosis, which doesn't really give that caregiver a clear understanding of what might be coming next. And that once again, the medical community needs to give them as many resources connected to that best guess diagnosis so that they can glean information from others who have been down that same path. And so when they just say dementia, your loved one has dementia, that's not really a diagnosis, and it's not enough information for them to clearly understand what might lie ahead.
So they need to get into the weeds more about what this means in the real world in terms of daily activities. And also, you brought up the fact about a calendar that you should expect to see these types of changes within a number of days or months or what have you as well. So
Kind of a moving calendar that's kind of an envelope. Well, most of the time, this is what we see within this 4 month period or 6 month period, but everybody's different. Kind of an understanding that the more they are aware of possibilities, the more they will be able to better make decisions about what might need to come next and not feel guilty about that, not feel guilty that within the next 6 months we're probably going to see a need for a higher level of care, or it's okay if you cannot do it alone. Most people cannot, and these are the kinds of resources that you can ask for as we see this continuing decline.
thank you. So, how can healthcare providers better take into consideration that caregiver's perspective?
Helping them to become dementia aware. And so actually have worked with many neurologists that just understood it's more than a bedside manner, Joe. It's really a leading educational opportunity to help them become their own little dementia expert in their loved one's care. And so I've had neurologists that actually give my book to that caregiver and say, this is your treatment. This is for you, because I need to shore you up because this is a marathon. I need to train you to be able to make it across the finish line in this dementia care marathon, and proper resources that are going to lead them down the way, and not and tell them it's okay to ask for help. That's what you should be doing. You can't do this alone. You have to build your village.
Thank you. Good point. How can clinicians partner with caregivers to create more meaningful experiences for their loved ones who are going through dementia?
Um,
In addition to becoming dementia aware, any other tactics?
well, I think that they need to allow them the opportunity to really vent about their own emotions, because this is so unbelievably painful. That's why it's so extremely difficult for those caregivers, but they're losing their loved one a piece at a time. And yet it's so confusing because there's still parts of and pieces of them that they can still access, and allow them to really express their frustration about how that neurologist really can't help them or stop it or fix it. But for them to listen, and for that clinician to say, yeah, I've worked with hundreds of people that are in this situation. Each one is, although it's unique, there's these gold threads throughout this entire tapestry that are common, and encourage them to join support groups. Encourage that clinician that wherever they are in their practice to have many resources. There's so many resources across the United States and it's growing more and more as people understand we need to be, as a society, this entire dementia aware safety net. We need to train everyone out there in the community, beyond the clinicians, beyond those family caregivers, the first responders, our government. We don't have enough of our government that's understanding this, and making sure that there's funding and resources out there for these caregivers. They may be on this road, like I said, anywhere from 2 to 20 years providing care for this loved one. It's not a 2-year diagnosis. Hospice companies have come to understand this is a long road. This isn't that 6 month. So everyone needs to understand how challenging and different this is than most terminal diagnoses.
What about the very motivated clinician? Can they become more familiar with caregiver experiences and know how to partner with caregivers and provide the best care for people living with dementia, even though, as you mentioned, there aren't many specific treatment options available?
I did this purposely and it was a bit challenging, but I have a wonderful video on my website called Inside the Mind of Someone with Dementia Symptoms. And I actually tried to show how the world looks and how they're experiencing the world around them and how the caregivers around them make these mistakes and involuntarily make them more anxious. So for a clinician to understand that, and there's lots and lots of good resources, but it's taking the time. And that's what I mean by becoming dementia aware. It's a deeper understanding of what the world might look like when this starts to happen in that person's brain and how we can reach them from the outside instead of just assuming that it's this or this. Let's really get a deeper understanding of what actually is happening. So, for that clinician, that neurologist, that physician, wherever they are, for them to really walk in the shoes of those with someone with dementia symptoms. And there, like I said, I have that available to them. There are other wonderful resources that have that available to them. And it needs, in my opinion, it needs to be the curriculum in those medical schools, dementia awareness. And I think that's going to be what really helps us to join hands and make that safety net that our society needs, that the world needs.
Are there any other suggestions for those many different healthcare providers who care for people living with dementia as well as their caregivers?
I do a 4-hour CE training for nurses and LVNs. And when they take that course, they would say, why didn't I learn this in nursing school? The front office can be dementia aware and help with that initial intro into that office. So anyone who's in the medical field who's having any kind of relationship, they're going to come across those that have these challenges. And for them to be able to help them to feel loved, safe, secure, and valued in that moment. I went and got a CAT scan just recently, and I was talking to that technician, and that technician was saying, well, my mom is having these challenges. And I often come across many of my patients that have some challenges like this. And it's so helpful for me to understand how to help guide them on an emotional level.
Thank you, Laura, for providing insights into what caregivers for people living with dementia need from healthcare providers and how clinicians can better collaborate with caregivers.
Thank you to Laura Wayman for sharing her knowledge with our listeners in this episode of Expert Voices in Dementia. And thanks to you, our listeners. Be sure to visit theneurologyhub.com for more podcasts in the field of neurology. Expert Voices in Dementia is brought to you by the editors of Practical Neurology.